Hello people, in this video we want to look at some scrambled words from Pediatrics. Look at the first one here. What do you think this is, guys? A clue. It starts with N. It's a criteria basically for cardiac murmurs, right? You're going to evaluate children with cardiac murmur. You're going to use this criteria, NADA criteria. So it has 4 major and 5 minor components. The major criteria are the systolic murmur of grade 3 or more, diastolic murmur, cyanosis, congestive cardiac failure. At least remember the major ones, okay? That's NADA's criteria. Let's go to the next one, guys. What do you think this one is? Take a clue. It starts with D. Something to do with the gastrointestinal system. Loose stools. Stools more than. How do you define this word? Diarrhea. Very good. Diarrhea, what is the definition? It's written here that it is loose watery stools 3 or more times a day. Okay, that is diarrhea. Very good. Now let's go to the third one, guys. What do you think this one is? I think it's pretty easy. It starts with A. It's a score again. And for a newborn child, you will you will give the score. You will give the score. What is the score? Apgar score. So A is appearance, P is pulse, G is grimace, A is, what is A? It's activity and R is respiration, okay? So you can have 0 to 10, guys, in Apgar. So now let's go to the fourth one. Here's the fourth one. How's it going, people? Do you want a clue? It is starting with a B. It is a type of milk. What is it? Breast milk. Okay, very good. Let's go to the fifth one. What do you think this one is, guys? It begins with P. Basically, they will eat non-nutritious substances. And it can be indicative of what? Pica. Pica can be indicative of some nutritional deficiency or some disease. So, let's give the answer here. It's pica. Let's go to the sixth one, guys. Try this one. What do you think this is? It begins with a V. Very common in after COVID. It is an injection or it can be oral, whatever. It's basically immunization. Yes, you guessed it right. Vaccine. Let's go to the seventh one. What do you think this one is? It starts with P. It is indicating a fine development milestone. So it's about how they hold their thumb and try to hold things at 1 year of age. They will have a mature pincer grasp. Very good. Let's go to the eighth one now, guys. What do you think this one is? The clue you want, it starts with a C. It's about feeding. So along with breast milk from 6 months, you should start what? Very good. You should start complementary feeding. Very good. Now let's move on to the ninth one, guys. Ninth one here for you. What do you think this one is? Do you want a clue? It's actually 2 words together. Something to do with the to do with the nervous system. Basically, if there is a folic acid deficiency, etc., it can lead to spina bifida. Very good. Let's go to the 10th one. What do you see here? Something to do with the head. Looks like a long word. 2 word distinct. You can split it into 2 words here. Starts with a C. Caput. Succedaneum. Very good. Caput. Succedaneum. Very good. Let's go to the next one. 11th one here for you guys. What do you think this one is? This is all about your sodium and potassium levels. It starts with an E. Yes, very good. Electrolyte. Electrolyte imbalance happens during diarrhea. That's why they will give ORS, isn't it? Next, oral rehydration solution they will give. What is this one? 12th one, guys. It's the name of a drug and it starts with N. And this drug is actually used for, in pediatrics, why do you use it? To prevent HIV, is it? Treat also. So it is nevirapine, okay? Antiretroviral treatment. Very good. Let's go to the 13th one here. What is this, guys? Do you want a clue? It starts with A. It's more than a child, a child grows into a adolescent. Usually up till 19 years they are ready to call as adolescent, right? 10 to 19. The age varies though. Go to the 14th one here, guys. And what is this? Anyways, guys, first let's congratulate you for completing so many. Let's go to this one here. What do you think this one is? Some disease name, some condition, name of a condition, respiratory condition name, starting with B. Bronchiectasis, okay? What is bronchiectasis definition? How do you define bronchiectasis? Basically, it's a chronic condition where the walls of the bronchi are thickened from inflammation and infection. They'll be dilated also, right? So what are the causes of bronchiectasis, guys? It can be cystic fibrosis, pneumonia, severe pneumonia, COPD, asthma, whooping coughs, tuberculosis, fungal infections, immunological disorders, etc. So many causes they have written here. Now let's go to the 15th one. What is this? Do you want a clue? It's the name of a condition, disease. Starts with a P. You're given vaccine against it. Whooping cough, it's also called as pertussis. Very good. Let's go to the 16th one. I think this is very clear already. So it is about the vaccines, etc. Starts with an I. You guessed it right. Immunization. Now let's go to the 17th one. What is this? What do you think it starts with? It starts with what you see here. Clump K. Basically in Clump K, why is this, in pediatrics, what is Clump K doing? Clump K is a condition. So basically, it's a birth injury to the nerves around the shoulder, brachial plexus, right? So it will lead to Clump K's paralysis or palsy, you can say. Okay. Let's go to the 18th one, guys, here. Again, K. Wow. What do you think this starts with, by the way? It's actually a condition, guys. Malignancy. Starts with L. Leukemia. Very good. Let's go to the 19th one, guys. What do you think this is? Try. It is two words kind of a thing. Small, micro. Very good. Microcephaly. What are the causes of microcephaly, guys? Microcephaly is usually because of, let's just look this up one second. It is because of infections during pregnancy like rubella, toxoplasmosis, cytomegalovirus, basically the torch infection, severe malnutrition, alcohol, certain drugs, teratogens, okay, can cause microcephaly. Now let's go to the 20th one, guys. What do you think this one is? This is about, it's starting with R. It's about electrolyte balance. So ORS. So what is this? It is, please give us the answer. Risomol. Basically, risomol is for malnutrition, right? That's why there's a mal here, right? So what do you say this is? This is rehydration solution for malnutrition. Okay. So what will be there here? Low sodium content will be there. High potassium will be there. And low sodium will be there. So sodium will be less. Okay. Great, people. You finished 20. Shall we continue, people? Great. Let's go to the 21st one here. What do you think this one is? Do you want a clue? It's again two words kind of a thing. Something to do with the brain. So it's a Permanent but non-progressive disorder, that's what they say, cerebral palsy. Very good. Go to the 22nd one here. Do you want a clue? Starts with a C. It's a condition caused by hypothyroidism in children. Cretinism. Very good. Let's go to the 23rd one. What is this, guys? It's a condition post-streptococcal, starts with an R. Rheumatic fever. Very good. Now let's go to 24th one. What do you see here? It starts with a T. Basically, it is associated with Downs, Edward. So many syndromes are there, right? What is this? Chromosomal abnormality. Trisomy. How many trisomy do you know, guys? Trisomy 18 is there. Trisomy 13 is there. I think 16 doesn't survive, right? 13 is called Patau syndrome. And 16, I think, is... actually, it doesn't survive, if I'm not wrong. 18 is Edward syndrome. Okay. Now let's go to the next one. And 21 is Downs. Anyways, that you know, hopefully. Now go to this. What is this? This is a disease caused by virus. Mosquito borne, vector borne disease. Yes. Starts with a D. Dengue. Very good. 26th one here. What do you think this is? It's something to do with the brain infection of the coverings around the brain. Yes, you got it. Starts with an M. Meningitis. Very good. Go to the 27th one here. What do you think this is? This is something to do with, it starts with a D. It's something to do with the erupting of teeth. Yes, dentition. You have primary dentition, you have secondary dentition, permanent, etc. Right? Now let's go to the 28th one, guys. What do you think this is? I think it's pretty clear. It's some infection of the lung. You can say lung. It starts with a P. Very good. Pneumonia. Go for the 29th one, guys. What do you think this is? Something, actually it is starting with a K. Think about it. And it's the name of an animal. It's about kangaroo mother care. Yes, very good. So skin to skin contact for preterm babies. What is this now? This is very interesting. It starts with an M. It's a reflex. Yes, it disappears, right? It's a primitive reflex, isn't it? Morose reflex. Very good. So we are done with 30. Superb. How is pediatrics sounding to you guys? Nice. Go to the 31st one. What do you think this one is? It starts with a N. It can be post-glomerular. It can be post-streptococcal. It can be something to do with the kidney. There can be hematuria, right? Nephritic syndrome. Very good. Now let's go to the 32nd one. Very common, was very common in India. Now it's eliminated almost around the world. Starts with a P, caused by virus. Yes, polio. Now let's go to the 33rd one here. What do you see here, guys? Basically, it starts with E, a condition where there's no control over the bladder control for the child. So, especially in the night, that is called a nocturnal enuresis. Very good. The 34th one for you. I think this is very easy. Protein energy malnutrition starts with a K. Kwashiorkor. Very good. There'll be edema in Kwashiorkor, right? What is this? Starts with a C. Some respiratory condition. Tracheobronchial. What is that called? Acute tracheobronchio. It's called laryngotracheobronchitis actually, yeah. That a steeple sign will be there in the X-ray, isn't it? So the answer is croup. Now let's go to 36th one. What do you think this is, guys? It begins with P. Adolescence, child to adolescent. What is that? Puberty. Let's go to the 37th one, guys. Here you go. What is this? Is it difficult? It begins with NS. This is some brain activity which is abnormal. It can lead to convulsions, and more of this will lead to will be called epilepsy. Seizures, more of that will lead to epilepsy. Seizures leads to convulsions, and more of seizures are called as epilepsy. Very good. 38th one, guys. What do you think this one is? Very important in pediatrics. You know, the growth, the development, milestones. So the height, etc. So it is stature. Very good. Okay, we are almost at the end. It looks like. Great. What is this one? This is a very small word, but nothing is striking. Okay, it begins with R. It's a condition. Could be associated with fever, dermatological, rash. Now let's go to the 40th one. What is this? It is starting with A. Something like it could be respiratory cause or metabolic cause. pH will be less. That means it will be more acidic, acidosis. Very good. This one. Again, protein energy malnutrition starting with M. Old man look, marasmus. Last one for you guys. What do you think this one is? A very important word in pediatrics. You keep saying this word so many times. Starts with a T. You keep saying what? Failure to thrive. Very good. So that's great, guys. You so deserve to relax. You have solved so many pediatric vocabulary words and hope you learned something too. Bye-bye.